Hi, welcome to another episode of Medicine Simplified. In this video, we will know about Dupuytren's contracture. Please remember, this is an educational video for medical professionals and medical students. Dupuytren's contracture is also called as morbus Dupuytren, palmar fibromatosis, or Viking disease. It should not be confused with Dupuytren's fracture, which is a type of ankle fracture caused by severe twisting. Dupuytren contracture is a myofibroblastic disease that affects the palmar and distal fascia of hands. In this condition, one or more fingers to become permanently bent towards the palm. That is, inward bending of fingers towards palm. Usually, fourth and fifth digits are most commonly affected. The disease begins in palm as painless nodules that form along longitudinal line of tension. The tissue under the skin of palm first thickens and then tightens, leading to Dupuytren contracture. Usually seen in whites, and disorder is often bilateral. Males being more likely to be affected than females. So this condition is mainly seen in whites and it is bilateral and most common in males. Coming to the pathophysiology, transformation of normal fascial bands into pathological cords cause this unique hand deformity. Dupuytren disease involves abnormal myofibroblastic growth in hand, predominantly composed of type 3 collagen. There are three phases in Dupuytren contracture. First one is proliferative, next in evolution, third residual. The proliferative phase has a characteristically high concentration of immature myofibroblasts and fibroblasts arranged in whorled pattern. This is whorled pattern, a flower petal in circular motion. In second phase, that is in evolution phase, fibroblasts become aligned in longitudinal axis of hand, following lines of tension. In final phase, that is residual phase, relatively acellular collagen, type 3 collagen, rich cords remain, causing contracture deformity. This disorder is not always progressive, and at least 50 to 70% of patients, it may stabilize or even regress. Risk factors for increased severity and recurrence of disease after treatment include male gender, onset before age 50, and bilateral disease, and presence of Garrod pads, Lederhose, or Peyronie's disease. Garrod and Lederhose disease is also known as plantar fibromatosis. Plantar fibromatosis is a condition in which nodules are formed in arch of foot. Coming to the etiology, it is a genetic disorder often inherited in an autosomal dominant but frequently seen with multifactorial etiology. It may be associated with diabetes, seizure disorders, smoking, alcoholism, HIV, and vascular diseases. We all know that males are more affected than females. Coming to the clinical features, there will be loss of range of motion of affected finger, blanching of skin when finger is extended. Proximal to the nodules, the cords are painless. Pits and grooves may be present. The knuckle pads over PIP joints, that is proximal interphalangeal joints, may be tender. Dupuytren disease is generally considered painless but can be painful if nerve tissue is involved. Most common finger affected is ring finger and least affected are thumb and index finger. Inability to hold objects and use the hand in many different activities are seen in this condition. As you can see in this picture, the nodules and pitting in first phase, cord formation in second phase, and fingers bent towards palm is seen in final phase. The most important test to diagnose Dupuytren's contracture is tabletop test, also known as Houston test. It is performed by having the patient Attempt to place the palm flat on exam table. If there is a flexion contracture deformity, the patient cannot straighten the finger, resulting in positive test. As you can see in this picture, when we request patient to place the palm on table, if all fingers doesn't touch the table, it is a positive test. If all touches the table, it is a negative test. Coming to the treatment options, consist of conservative management, needle aponeurotomy, collagenase injections, surgical dissection, and fasciectomy. If you like this video, please like, share, and subscribe to our channel. Thank you.